Obama promised Americans they will not lose their health care coverage. Remember? Well, it's wrong. A new congressional study shows the high cost of Obamacare mandates will virtually guarantee that large companies will drop all health care coverage, and they'd rather pay the fines, and that means you, the employee, will be pushed into the government-run, one-size-fits-all socialized health care program. For the companies, it will save $422 billion over the first 10 years. That is huge. For you, the employee, it is enormously troublesome. So let's talk. We have CNBC contributor, former Vermont Governor Howard Dean. He's the author of Howard Dean's Prescription for Real Health Care Reform. We bring back Dr. Nan Hayworth, Republican Congresswoman from New York, Westchester, actually. Nan Hayworth, this is something we've all known. The firms would rather pay the fines because the rising cost of mandated health is going to be so great. But what it means, as I understand it, is you, the employee, is going to be pushed off into the great unknown. Is that true? Is that the fact?
Yes, absolutely. Starting in 2014, clearly these were Fortune 100 companies that were surveyed. 71 companies responded. 30% of them are planning on dropping their health care coverage and simply paying the fine because it is far less costly for them, to the tune of approximately $5,000 per employee per year.
Former Governor Howard Dean, welcome back. This study, which comes out of the Ways and Means Committee, echoes a McKinsey study, which echoes Pew studies, that this is all going to happen. What's your response to it?
Well, I'm sure you'll pardon me if I'll be slightly cynical about a very partisan committee in Congress that happens to be run by the opposition party in an election year coming out with a study like this. But I do believe the McKinsey study is right. I think the general direction of this study is right. I question the numbers. What I've found in the discussions that I've had with major CEOs is probably the big companies won't do this, but the small companies will do this. I think it's a good thing, because I think employer-based health care is a bad idea, and it has been, and it makes our small businesses uncompetitive. So what's going to happen is they'll pay something into a pool. Their employees will get their health insurance through the exchanges, and they'll get some help from the government, which they ordinarily wouldn't have gotten. So I think we may disagree about how many of these companies, and I don't think the big ones will. I think a lot of small businesses will do this. I think it's good for the small business communities.
But Congressman Nan Hayworth, it was precisely the Fortune, what did they say, the Fortune 100 that they studied, and we saw the waivers drama where the large companies that didn't want to mandates, particularly retailers and service companies.
Various unions as well.
And they got waivers, but now comes the moment of truth. And hanging in the balance is the ordinary person's health care insurance, which the president said they'd not lose. That's the biggest thing that troubles me.
This plan, this massive law, but Governor, they will. And this massive law was sold to the American public on the premise that if they like their health care, if they like their health insurance, they would not lose it, it would not change. And that is clearly false, and there were so many voices that predicted this from the get-go. And there will be more, Larry. This is a massive government takeover of our health care.
This is nonsense.
And it will be enormously costly.
Let me explain to people what actually,
from care and toward
let me explain to people, if I could for a moment, explain to people what really happens. Let's just suppose I'm working for a small business with 6 employees. A small business doesn't think they can afford this anymore. They say, sorry, Howard, you've got to get your insurance someplace else. I go online to an exchange, and I choose from 4 or 5 or 6 private insurance companies. This is really more like Paul Ryan's approach to Medicare than it is some government takeover. I just pick an insurance company, and the government helps me buy the insurance if my income is low enough. That's exactly how this works. Fewer people are going to be uninsured, and the private sector is just as much a part of this as it ever was.
These are heavily subsidized. These are heavily subsidized exchanges.
And at low income levels, they are.
Let me just go to Ms. Hayworth.
$1 trillion bureaucracy.
So that's it. We have not budgeted for this. So you've already seen the cost of Obamacare has gone up from about $800 billion to about $1.6 trillion. All right, $1.7 trillion. We have not seen the peak in those estimates. Those estimates are double the original estimates. And besides the fact that a lot of people are going to lose their insurance and have to switch, Where are we going to pay for this? This is another bankrupting entitlement.
Well, Larry, that's the problem. And actually, you can look at the ended savings that those Fortune 100 companies are saying they're going to have, about $5,000 per employee per year, going up to about almost $10,000 in 2023. And you can anticipate that those costs will only rise as the federal government takes over the program. Because look at what we just saw with Medicare Part D, with the waste and fraud and abuse that take place because the government simply does not have the same ability to follow these things as do insurers that depend on the marketplace and have to compete and have to be effective with the dollars they get.
Go ahead, Aaron. How do you respond to that? This goes to the heart of the question. You're going to lose your insurance. You're going to go to inferior plans in most cases. And
this is ludicrous. You guys stop this, really and truly. You sound like talking points from John Boehner. Knock it off. Here's the fact,
These are one-size-fits-all plans in the main.
Do I get a chance to just shout your propaganda at me?
Howard, listen to me.
This is an analysis. I can't listen to you. You're just making stuff up.
I'm making stuff up. This is what everyone has said.
Larry, you're being silly. Come on. Do I get to explain this thing or not?
Go ahead. You're going to get the last word, Howard Dean. How is this wrong?
What you said is not entirely untrue. People will lose their small business insurance, or sometimes, let's just say some of the Fortune 100 or whatever, and they will go buy insurance the way Paul Ryan suggested Medicare recipients do on an exchange. And the government will help them if they have low income. Medicare Part D, maybe this and maybe that. That was a Republican program. That was passed by Republicans. Let's stop this stuff. This is a serious problem. You want to know how to pay for this? First of all, the Congress has got to have the guts, both Republicans and Democrats, to pay for all doctors and hospitals a flat fee for every Medicare recipient instead of paying them by what they do to them. That's what the real savings is going to be.
So
nothing you do in this health care program.
I just want to say, Ardeen, you know I love you, but you agree with me. A minute ago you were telling me it was propaganda. Now you just said it's not entirely untrue.
You keep using these words like people are going to lose their insurance and it's inferior product. This is the same insurance product that you have right now.
No, it
nonsense.
isn't. Are they not? Tell me.
It will not be. And Larry, let's not forget that 2010 plan also shifts, as you know, Governor Dean, it shifts $500 billion falsely. They're using false accounting, using an accounting trick out of Medicare into that plan. We can't afford to do this.
I got to get out. I don't think we can afford any of it. I never thought it was a good idea, but at least Howard Dean said I was somewhat right. That's concession. Governor Dean, thank you, sir. Congresswoman Nan Hayworth, thank you very much. Coming up on Kudlow, what's the greatest